Okay, so this video is the first one about compression. Before that, I just want to see that we are having a good towel techniques. So, taking these, we're having the right pillow. The lower towel is alongside, and the upper towel is parallel to the hands. You could tuck under this towel and put it in such a way. I'm going to go quickly through the hold and getting into effleurage, petrissage, and then to the technique today, which is compression. So I'm going to do this. Can I undo the? Thank you. And then start with effleurage. As a reminder, lots of body posture, right posture. At the beginning, the first effleurage, really slow. Nice and slow. And if you've seen, I actually move my front knee more than anything else. I don't do much with my upper body. It's not that, yeah? Effleurage, again, I'm moving quickly. I start doing petrissage, and then suddenly I feel an area that feels a bit hard. What is it? What could it be?
Stiff muscle.
Stiff muscle? A knot. So what is it, a knot? Blood tension area. So a knot would be in a muscle, and it will be, how does it feel? Hard. Is it like a whole muscle or just a specific area? So a specific area, maybe the size of that, which is tension. Or is it not always an area that you feel tension? Could be something else that is a knot.
Like the blood supply.
Okay. So it could be the blood, could be the blood.
Or some people have this fat like.
Maybe fat. So what could be, beside tension, there is, and not also could be an area that is sensitive to your client. So it's quite subjective, yeah? Sometimes you feel it and said, oh, but other times you don't feel anything, but your client says, ouch, it's tender. What could be this tenderness due to? When you just go through, what could be this tenderness due to?
A little bit of trauma to the muscle, maybe.
Trauma to muscles. So what would it be?
Bruise.
Injury.
A bruise, injury. Okay.
Bad posture.
Bad posture. And what would it cause to the muscle?
Inflammation.
To contact.
A slow movement or not movement.
Spasm.
Less movement, spasm, reduced blood circulation. So an injury or tension would cause, when we tense, are there more blood coming to that area or less? So squeezed out. Maybe there is some scar tissue. Remember last time we talked about the scar tissue, collagen fiber build, make it like nasty area. So we have less blood circulation. Spasm, tension. So we have to work with these two on the next technique. Yeah? Can you find the sponge? You see on the top there, yeah? Okay. So is effleurage going to help with this?
No.
Why?
Superficial.
Too superficial, not deep enough, yeah? Is petrissage?
Yes.
Could be.
It's going to warm the area.
It could be, yeah? But are you specific enough on to...
No.
So you need to be maybe more specific, yeah? Good. I would like to show you a sample of what this new technique called compression is. And for that I will use sponge. Let's say that this is a connective tissue like a muscle, okay? When you do effleurage, you're not really going deep in. When you do petrissage, is more general for the whole area. But what you need is to press on a specific area. It will take time to feel, to palpate, and to ask the client whether if they see the problem, if they can feel it. So what do you think, by doing that technique and then releasing, and again, wait a little bit, and releasing, and maybe again, what do you think the physiology of it? How does it improve
Because it was
the reduced blood circulation and the tension? What does it do?
It promotes more blood supply into it. It squeezes it out and brings it back in.
Yes. How do we call squeezing out, bring it back, squeezing out? Flexing, or I've used the different terms.
Contraction.
It's like pumping.
Pumping.
So I squeeze the blood. Imagine that I do that, squeezing it, and fluid around coming back into. Squeezing, blood goes out, releasing, blood goes in. Squeezing, blood goes out. Now when I release it, is it the same blood that comes in, or it's a different one? It's a different one. It's the blood from the artery. It's a fresh blood. Okay? So squeezing, really there is pumping effect. Okay. Anything else, if I start doing that, so we're looking at increasing the blood circulation. What about the spasm? Where is this spasm starts from?
Brain.
Thank you. Isn't it?
Right.
So the brain. So what do you need to do to reduce it?
Relax the brain.
Relax.
So you can relax it, you do that. But also, we need to talk about one effect of pressure. When you apply pressure, let's say from the same point, you have pain sent to the brain and other symptoms. Now, if you have only the pain, you leave it, the brain feels pain. If you have pain in an area, what do?
Rub it.
Why?
Because it
Make you warm.
blood.
No. Also, yes, but also, how does it soothe
It
it?
generalises the sensation rather than it being specific.
So
The
relaxes.
heat relaxing the muscle.
It heat relaxing muscles.
It distracts you.
It distracts.
Yeah.
It confuses the brain. What it does, it tells the brain, look, pain is coming. Oh, do you feel that now? The brain starts thinking, oh yes, I feel the pressure. Oh yeah, okay, I can relax. The brain starts sending less impulses because it relaxed, because now there is a new sensation. In a way, it's kind of a funky distraction mechanism that allows the brain to move on and to relax. Yeah? Also, there is some mechanical stretching of the collagen fiber, elongating them. So all in all, it creates a better physiological effect on this area. Pumping, reducing the tension from the brain, and stretching it. Okay? Can I show you now this technique? Okay. So the compression technique is very specific. It always starts with palpating and feeling. Okay. Is it tender here? No. Okay. Here? How is it here?
It's not tender, but it's tight.
Mm-hmm. First, I want you to appreciate it does take time to feel these points, yeah? When you find it, Then you need to stabilize yourself first. So you can't start it by saying, okay, I move in. You need to prepare yourself. Yeah. So the table relatively should be a little bit lower because now you need to apply your weight. So it's not coming from the finger, but actually is applying it from your body. You need to move in, and by doing that, you're moving your weight and you having more force coming to your fingers. Okay? I'll show you a few ways you can do that. First, you apply all your fingers around to stabilize that. I don't like to see that because you can glide too much. You step in, you prepare yourself, and then slowly you're kind of sinking into it. You can do it in two ways. Either you drop your weight down or you're putting your weight forward closer to them. Better to do both. You drop down and in. Now, the rhythm is quite important. If you do it too quickly, what do you think is going to happen to the client? Pain. So you need to really think like, I call it like the submarine. Imagine submarine is quite heavy and it goes up. So to drop down, submarine cannot just drop quickly. It has to go slowly in to equalize the pressures. So really, imagine if I have 10 seconds, only at second 10, I'm fully deep. So I need to really start slow. So I can count. Now I barely touch. 1, 2, 3, and I increase it slowly. And you know what? When I do that, I feel that she's breathing. It's kind of bizarre, but before that, when I did it fast, it did not happen. Okay, 10, I'm in there. Do you think when I'm in there, I can start now massaging really strongly? No. Because when I work deep, I have to be really careful. Okay? And then slowly you're releasing back the pressure. So you go slow in and slow out. Variations. First of all, client. You can tell them something like, I would like you to take a breath in, and when I press, take all your air slowly, take your air out. Good. And then you keep it, breathe in, and slowly take your air out. You see, what I don't do is breathe in, breathe out, because they would become stressed. I actually, with my voice, I need to tell them the quality. Yeah, so you have to be quite kind of a melody. You have to have a melody in your. So, first of all, it will help the client to not talk. Remember this client? So, secondly, it helps them to relax. So this is variation 1. Variation 2, again, you do the same thing. Breathe in, and slowly through your nose, breathe out. When I go all the way in, I want you to come a bit close to that. What I'll start doing, by the way, on which muscle I am now? Erector spinae. What I do very little, I work across the muscle. Do you see something moves under my fingers?
Yes.
Yeah? Now, you have to be really careful and attentive, not to do it too quickly. Yeah? So very slow. Work onto this area. Okay? And then easing off. This is called cross-fiber compression. Yeah? So you are working, if the fiber of the muscle goes there, you're working across. You can work along the muscle, yeah, as well. But I want you to understand that it's not that. it's very delicate. The work is very delicate because it's deep. Okay. So this is another one. Last one for now. Actually, why don't we leave it? Why don't we start and we'll get, say, 15 minutes for each group. I would like to do it in a smaller chunk. So what I would like you to practice, start with the effleurage, pétrissage, and when you do that, you have one thing in mind. I want to find a knot. A knot is objective when you feel it, and subjective when they feel ache or tension or pain. When you stop, then start working first slowly. When you get more confident, do it with breathing, and then do with a bit of movement backward, forward, a bit of movement side to side, and even you want to do a bit of circle. But very slow. I want you to feel a bit confident about doing it. Okay?
Just one point or the whole area?
You find one area, I want you to practice. If it's too much, move to another area.
Will there be a knot, or will be something there to feel?
Depends on the client.
There will be
If
a
some
line.
client would have, if not, try to search in a few minutes. If you don't feel, you have to take an area and do it. Okay, because we don't have the whole afternoon to do that. So find an area and practice it. Thank you. Let's go.